Save some money.
Welcome aboard, Facebook. This is Jim Blythe with Cedric White. And if you see up on the screen, Dr. Misty Ely, we're here for you today with a really great program about mental health, counseling, and all that is going on to help you. So stand by as we start the broadcast now. Welcome to the Veterans Impact Show, where our motto is Charlie Mike. Continue the mission. I'm your host, Jim Blythe, U.S. Navy Vietnam veteran and certified senior advisor. Join me as we feature veterans who continue the mission of leadership and commitment in our communities after serving our great nation. Why, you never know who you're going to meet or where we're going to go. So welcome aboard. Hey, you're with us on the Veterans Impact Show. My beautiful wife, Diane, is at a retreat. Again, this is Cedric White. He's new to our show. He has become a very, very dear friend. He is a minister, marriage counselor, and I got to tell you, last weekend, Diane and I went through your marriage counseling workshop.
Yes.
It was amazing. It was really amazing.
We enjoyed doing it. We had about right at 28 couples there, and very engaging. And we go through just the steps of course, communication, steps of commitment and trust, steps of even intimacy. We discuss all of those things.
Yeah,
and
you're kind of funny in some of that. I'm telling you, you and your wife cracked me up. But I want to say this is a fantastic program. Please share this today with all of your friends on Facebook and on YouTube as well, because we're going to be talking about some good things and some bad things. But this is going to be a really great program with Dr. Misty Ely. Now, I need to tell you that a very special thank you to my company, Fairway Independent Mortgage. I'm a reverse mortgage specialist. I've been with Fairway about 3 years. I've been in the business about 20. My NMLS number is 311548, and our corporate one is 2289. And I'm a specialist in helping seniors with financial solutions, and we are an equal opportunity lender. So if you want to know more about us, go to Fairway Independent Mortgage, and they're gonna tell you everything you wanted to know. The other thing is, I got to say a special thank you to Nathaniel and all you do in setting this up for us. Also, I want to say thank you to DBTV Network, who puts us on Amazon Fire and Roku, who is also lining us up for other networks, other people to be able to share with. And I just want to say a big thank you to also to AUN Network out in California. You guys stay dry. It's kind of bad right now. So thank you for being on board. Now, we're through with all of that, and the attorneys can relax.
That's right.
You bet. Dr. Ely, I have met you a number of times, but I really got to meet you a couple of weeks ago at the finishing of the Reboot counseling work deal that I did with Lieutenant Colonel Ginger Simonson, and you have a great story to tell. So first of all, tell us about your background. You're a United States Marine, and then tell us about your book. Tell us about what got you into being Dr. Misty Ely, not Marine Misty Ely.
Thank you, and thanks for having me. Of course, the graduation ceremony was super powerful, and it's just a reminder of how enabling and wonderful veterans can be when they're healthy and they're helping one another. The peer aspect of veteran work is so important. So I do have a book, but a little bit about me. I am a Marine Corps veteran. I served from 1997 to 2006, so about 9 years total. I did administrative work, so I was an admin chief, separations, promotions, retirements, awards, the good important stuff you want to have. A good
you're
friend.
You're my best friend.
Yes.
You would have been my best friend.
Exactly. Leave papers, what happened to them? Who knows?
Yeah.
Exactly. So that's what I did in the Marine Corps. My first duty station was Okinawa, Japan. Backtrack a little bit. I went to Paris Island for boot camp, where that used to be the only place we trained female Marines. Now we're in San Diego as well. But I went to Paris Island, went to North Carolina for school, and then I went to Okinawa, Japan as my first duty station. From Okinawa, I requested orders to the West Coast, and they gave me Pensacola, Florida. So I was like, it's close, right? Kind of. And then from there, I went to Beaufort, South Carolina, and that's where I got out of the Marine Corps.
I got to
At
tell
that time,
you, of your duty stations, I loved Okinawa. I was there for a very short time, but I also love Pensacola, Florida, and I was never stationed there, but that is a beautiful town. So one of the things is you had a great opportunity to travel and see some of the world.
I
And I
did.
imagine out of Okinawa, you got to go to Japan, maybe the Philippines, some of the other places in the South Pacific.
I got to go to Hong Kong, Hong Kong City, Hong Kong, on a humanitarian relief effort. So I was on the USS Fort McHenry for about 30 days. That's when I was really excited that I had joined the Marine Corps and not the Navy, being on a ship. So that was pretty remarkable. I didn't get to go to mainland Japan until years later. In Beaufort, I married an active duty Marine. We have since divorced, but he was aviation ordnance. Bombs, missiles, rockets on the F-18s is what he kind of did. So we went anywhere a plane could be stationed, essentially. And so I went to mainland Japan. I went to Iwakuni then, and then north at South Carolina and Virginia. So I did indeed get to travel the world along with my 2 kids.
How fun is that? Now, how did that prepare you, or how did that set you up, or what did you go through that caused you to want to be um, a psychologist?
So a lot of things. I came from a very troubled childhood. A lot of veterans joined the military to escape their home life, and that was definitely my story. And so I moved out of my parents' house at 15, graduated high school early at 17, and joined the Marine Corps and kind of never looked back. And so for me, it was this wonderful new brotherhood of belonging and sense of purpose. I am 4th generation veteran. So everybody before me was in the Army and all of them were men. So actually, when I told my retired grandfather, who was Army Corps of Engineers, I told him I was joining the Marines in 1997. He said, they don't even have female Marines. That's why they're called A Few Good Men. And I was like, no, Grandpa, it's 1997. They have women now. And so for me, it was also about carrying on the legacy of that veteran service was really important to me. But how I got into being Dr. Misty Ely, not a psychologist, I'm a traumatologist, which is a little bit more confusing, but my degree is in education, a doctorate in education and community counseling. So psychologists, they just understand the world a little differently. But for me, a lot of it had to do with my lost sense of purpose. I got out of the Marine Corps and didn't know what I was going to do with my life. I left the Marine Corps because I didn't have a family care plan, that handy dandy thing you're supposed to have of who's going to take care of your children when you deploy. My ex-husband had come from a troubled childhood. I had one too. So we didn't have anybody that could take care of our kids. So at 9 years of service and E9, I mean, not an E9, I was an E6. I left the Marine Corps to be the stable parent for my children, which basically meant I gave up my dream of being in the Marine Corps for 20 years. And I had to find a new sense of purpose. For about 6 years, I did a bunch of different jobs. I was a probation officer, worked for the Federal Bureau of Prisons. I started doing substance abuse treatment and education with veterans when our active duty service members, when we were stationed in Iwakuni, when I was a dependent spouse. And we sat around this room and all these veterans would talk about how they had gotten in trouble. That's why they were sitting in a class with me. They would say, like, you don't understand. All I did was walk home from the E Club drunk and I got a ticket. Or I was shooting my paintball gun outside my barracks room and I got a ticket and now I'm here, which was true. They had gotten in trouble. It was their first alcohol related incident and they'd have to come see me for 16 hours of education and alcohol, right? So they go around the room like, you don't know what it's like and you don't know and you don't know. And at the end of the I don't know, I said, Misty Ely, former Staff Sergeant, United States Marine Corps, I do know. And it was this huge epiphany that I was in this room with all these active duty service members. And it was the first time in my life in 6 years that I had felt like I truly belonged because I did understand. The Marine Corps taught me to deal with my stress by drinking, by you had a good day, you got drunk, you had a bad day, you got drunk, you passed field day inspection, which literally meant you cleaned your room, you got drunk. Everything revolved around alcohol. Right. And then when you got in trouble, you were the worst person in the entire world. And so for me, that was when everything kind of flipped a switch and I went back to school, got a master's in behavioral medicine and then another master's in social work. And so that's what I did for a long time. I was a licensed clinical social worker and then licensed clinical social worker supervisor. And now I'm not in practice at all. I supervise instead and I educate because for me, I've always said I'm saving the world one veteran at a time, but being able to educate other clinicians how to work with veterans, I get to save even more.
You know, Misty, when I was in the Navy in the 1960s, I got out at the end of 1970. It wasn't that you go get drunk, but that you go had it. You got to let the steam blow off. You went and you had a good time, and you heard rock and roll music. You went to the EM club. You went to the O club. If you were an officer, I remember the stories of the O club in QB Point in the
Mm.
Philippines were pretty amazing, and everybody was young and crazy, and we had a good time. I don't think we intentionally got drunk till further down the road when it became situations became unbearable. And
Right.
we had a whole lot in 1967. Now think about this for a minute. We had a whole lot of veterans who had been in World War II and Korea, and they had some severe PTS problems, but we didn't understand that.
Exactly.
We didn't know. And they treated, and you went through some of that,
Correct.
they treated themselves with alcohol, and that had become a huge problem. Now, it is my understanding because I know I've known the last several COs of the Joint Reserve Base. I have a lot of friends that are admirals and as well as enlisted. That is a different opinion in the Navy. They don't do that the same way anymore. They don't promote that the way they
Mhm.
did. I understand some of the O clubs and EM clubs are now people don't go, so they've shut down.
Mm.
Mhm.
So it's not the same, and that's a good thing. But back your day, my day, was
Mhm.
especially in Cedric's day, yeah, that was huge. Self medication.
Right.
Well, and quite often, Jim and Doc, quite often it went from, like you said, it went from just having fun to becoming the coping mechanism,
Yes.
right?
Absolutely.
When, okay, it was fun, you hung out with the fellas, with the ladies, with whatever, right? And that was just the norm. And then as problems came, right, I could dull my senses with the alcohol and unfortunately, eventually drugs was the
Mhm.
way to do it because there was nothing to help us with the trauma that was going on in our head and in our lives.
And I got to tell you, Misty, moving over into the area that you've moved into, you had a huge feel because so many went through so much,
Right.
Mhm.
especially Vietnam, my generation. Now, I was
Mhm.
lucky. I was on aircraft carriers. I did go up and volunteer and work on the flight deck at night. But I got to tell you, the sound, the noise, you cannot imagine what it's like to be on a combat aircraft carrier that's doing flight operations 24/7 a day for about
Right.
30 days. Yeah,
Hmm.
it'll make you it will really disturb you. Plus you have hearing problems, you have other kinds of problems. But we've also had so many people who were severely injured or even moderately injured. But we didn't know how to take care of that. So a lot of what was being done, both in the military world, in the VA, and in the civilian world, is those things got treated with drugs. Hey, you couldn't sleep at night, they give you a drug.
Absolutely.
You were depressed, they give you an antidepressant. And I had a close friend that I really cared about, and he had some depression problems. They put him on antidepressant, then he couldn't sleep. They gave him sleeping, then they gave him this, then they gave him that. He was taking a pharmaceutical cocktail, and 3 o'clock one morning, I got a phone call from his wife, and we won't go any further, but let me just say, he ate the magic bullet that was 150 caliber. I'm telling you that this is a thing that is not only in the military, but it's in the civilian world as
Yes.
well.
Agree.
And so part of what has always been is the military has led the way. So the military now is more into counseling,
Mhm.
into all of these things that we're talking about. Cedric, you're doing marriage counseling.
Yes.
They're supporting that. So in doing that, can you tell us a little bit about who you're with, Symbios, who I've become very familiar with. I'm very close friends now with Dr. Ashmore. But what is Symbios, your company that you are head, the director of clinicians, correct? In
Yes, sir.
education.
Clinical director. Mhm.
Tell us a little bit about what Symbios is, but what you do in Symbios.
So I'm the clinical director of 11 clinicians. So Symbios, in a nutshell, they get a referral from the VA. There's a process. They see the medical doctor head to toe. And then basically, after a psychological evaluation is done, they are recommended for therapy based on what their diagnosis is. So some veterans will come in and their diagnosis will be PTSD, anxiety, depression, those kind of things, right? Or a substance use disorder. And my job is to pair them with the right clinician based on what their specific needs are. And then once I pair them with the clinician starts individual practice with them. So they're usually seen once a week. If the client is in active crisis, they might be seen twice a week, like if there's a lot of suicidal ideation and such. So we do that. One of the first things I did when I came on to Symbios in June was, like any good leader, sit down and get to know my team and then ask them what they needed from me, because for a while there had never been a clinical director, so we had clinicians without direction. So I asked all of them, what is it that you need from me? And all of them said, training. Hey, I'm an educator, I love that. Right? So I said, okay, what do you want to learn? And that's what makes Symbios so unique, I think, compared to a lot of CCNs out there, is my clinicians are all trained in different things. So first they have to go through military cultural competency training. They go through moral injury training. They go through military sexual assault training, so they can understand these dilemmas when a client comes to them, when a veteran is in need. They also go through training on suicide, either counseling to less lethal means access, or how to differentiate between suicidal ideation, and then also how to deal with post-vention. So preventing the suicide. Post-vention is after a suicide has taken place, how to help the family and how to deal with the veterans when they go through that process, because a lot of veterans have lost very good friends to suicide. So for me, that's the biggest kind of amazing part of my job, is being able to help these clinicians understand what really their clients' needs are, to get them the education that they need and the training that they need to better equip them to deal with the ever-changing veteran population. There was a lot more substance use that we worked with in the beginning. Now there's less substance use, but there's also a lot of no healthy coping skills, which is something we touched on a little bit ago. That's actually why I wrote my poetry book, because poetry was how I learned how to cope, and doing art instead of drinking.
I think this is phenomenal. So we're going to continue this conversation in a minute, right after we have the word from our sponsors. But in doing this, what we're talking about is mental health to save lives.
Absolutely.
That's the bottom line. And this is highly needed. People are really sometimes don't recognize that they need it. I know how many times a wife has driven a guy to the clinic and said, you go in there and you work with them, or you're on the street. So when we come back, Cedric, you bring us back. Let's talk about saving lives more. And let's go in and let's talk about moral injury and some of these other things so people understand. You're watching the Veterans Impact Show. We'll be right back. Welcome back to the Veterans Impact Show. And thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation.
Well, welcome back. I am Cedric White, co-host for the Veterans Impact Show, here with Jim Blythe. Diane is out today, and we have as a guest today the great Dr. Misty Ely. Dr. Ely is with Symbios Integrative Healthcare. And Dr. Ely, you said something before the break previously. You talked about coming from family trauma, going to the Marines to get away from that family trauma. What happens, a lot of people do that exact thing. They follow that pattern. The problem is they go from family trauma to the military, where they experience some level of trauma, which causes PTSD, right?
Mhm.
And quite often, they have to seek help afterwards to avoid the alcohol, the drugs as the coping system. You provide that at Symbios. Help us to understand, because there's a process before a vet or a military guy will just allow someone to speak into their lives. There some things has to happen. Tell us about that, Dr. Ely.
You're absolutely right. And there's two biggest predictors of if mental health therapy is going to be successful. Number one, client and therapist rapport.
Mm,
And number two, client's willingness to change.
yes.
So our job at Symbio's, my job specifically, is to pair that client with the best suited therapist for their specific needs. Some clients come in and they say, I only want to see a female therapist. And that has to do with they're a female veteran and they have military sexual trauma. They only want to
Right.
speak to a woman. Some veterans come in and they say, I only want to see a veteran therapist because they're going to understand me better. So I pair them with a veteran. So my first step is to figure out what the veterans' needs are, and knowing my clinicians as well as I do, I pair them together. So that helps build step one, building that
Right.
rapport, right? And then step two, if a client, by the time he gets to us, normally he's either in crisis or he's about to lose everything. And for a lot of us veterans, admitting that we're wrong and that we need help, extremely difficult, right? And
Right.
so
Right.
it could take months and a lot of pressure and pain from family systems, from the job, from being involved in the criminal justice system before a veteran actually decides that they want help. And then once they walk through the door because they're ready and they want help, usually they're pretty deep into the
Right.
hole. And so our process is to get them safe and stable before we can even start processing the trauma. But a lot of the work that we do is safety and stabilization, which takes a little longer when it comes to veterans because we don't easily trust. I've taught a lot of classes in the civilian world, and I often talk about how trust is very different. And a lot of civilian clinicians will say, how do I get the veteran to trust me? And I say, okay, well, trust is earned, but let me
Right.
give you a perspective of what it's like to be a veteran. So in a classroom, I would have 20 clinicians, right? And I'll say, how many veterans are in the room? And there might be two. And I say, okay, so if somebody opens the door to our classroom and throws a grenade in here, who's jumping on the grenade to save everybody else's life? And usually
Right.
those two
Those
veterans will
two.
raise their hand,
Exactly.
right? And I say, that's what trust means to us. Trust means that I'm willing to die to save your life. I'm willing to do
Mhm.
anything it takes to be able to be that person that is there for you. And so that trust and that sense of belonging is so important to veterans. Sometimes having a veteran clinician is the very first step of getting them to open up. So that's, pretty important.
Right. I love what you said in reference to the rapport building, right? That takes time. We call it peer, right? That peer to peer. Quite often, when we have clients to come in, we'll share our story first, so that they know, okay, you've been through something, so
Mhm.
yeah, you're not. And as I hear you saying, you don't do cookie cutter clinicianing, right? You're not
No, sir.
just we have a pattern and you come in and we step you through. No, it's a case by case situation, which
Yes, sir.
again builds trust because it shows you're listening to them.
Yes, sir.
Let's talk just a second, too, to add to this. Symbios doesn't just take somebody and say, okay, you need counseling, you need help. You go through, and I've been through it, a rather extensive check with a medical doctor. You
Yes.
go through the I'm trying to say, what is it I'm trying to say? You go through a process to determine what's going on.
Evaluation.
Evaluation, thank you. And some of that may be pain management. Some
Yes,
of
sir.
that may be alcohol management. Some of that may be, you got to have a behavioral assessment. You got to figure out what's going on. One of the things I learned some time ago is that people who have problems can't sleep at night.
Mhm.
They have insomnia. It's terrible and drives
Yes.
them crazy.
Yes.
So one of the things is Symbios has a vector, which is an emerging technology that's FDA approved, that's AMA approved. It really works. And what it does is it causes through non-contact electrical stimulation, I think it's called microcurrent,
Mhm.
where it enables increased blood flow. It's amazing because every guy that I've been in there and talked to says, well, after using the vector, I can sleep at night. Once you can sleep at night, you got your head about you, then you can begin to get help in understanding the problems. So it's part of a total process, is what I'm trying to say. It's not just one aspect.
Right.
So you're working with that. Pain management is huge. This thing is amazing. I have seen pain management and I've experienced it myself.
Hmm.
Total body healing. I had um, reduced kidney function in one of my kidneys from years and years ago. I started using the Vector. I get blood work because I'm trying to monitor because I also have very early stages of cancer in my prostate. Guess what? My kidney function after the use of the Vector went back up to normal.
Mhm.
So it's not just one thing that Symbiose does, it's a whole health. So when we come back, I want to
Talk
dig
about
more though then about what's going on in taking that whole health and making that veteran whole again, making that veteran strong again, making that veteran able to function in his family
it. Hmm.
and in his community. And let me tell you, I've interviewed a whole bunch of them, and it is amazing what they're saying about the changes that have come about thanks to all of the things that Symbiose is doing. And I hope this is an emerging way that this is done across the nation to be able to help veterans through the VA's Community of Care program. It's a great program. But we're going to be right back after these words from all of our partners. Cedric, you bring us back again and you get us going because you asked some
We'll do
great
it.
questions.
Thanks, sir.
All right. We're going to be right back. This is Veterans Impact Show. Welcome back to the Veterans Impact Show. And thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation.
Well, welcome back. Jim Blight and Cedric White here. Missing Diane today. We have Dr. Ely with us from Symbiose and Integration Health. Dr. Ely, I want to ask before we go any further, because Jim has been telling me about Symbiose. He's been telling me because I've been complaining about a lot of the symptoms that he's talking about, the sleep and the pain management. How does someone connect to, get involved with, uh, have their first session with Symbiose? How does somebody contact you guys?
Great question. So, number one is right now the way the referral process works is the veteran goes to their primary care physician at the VA and requests a community care network referral to Symbiose.
Okay.
And then I believe Jim probably has our EIN numbers, all those important numbers that they need to have in order
Right.
to go into TriWest and get that referral. But basically, that's the very first step, is to say, these are the things that I'm struggling with, and I would like to see Symbiose because I know they can help with those things. Jim, before the break, you said something super profound, and I just want to piggyback on that. You talked about insomnia. So a lot of people don't understand that sleep is as important to your health as eating and drinking water. So those Maslow's hierarchy of needs of sleep, eating, food, all those things. If you're not sleeping, how long do you think you're actually going to be able to live and not have delusions or hallucinations and that kind of stuff? Sleep is such an important dynamic of our every single day life. And you're absolutely right. There's no way to get better with treatment if you can't get any sleep. So Vector is one of those things that really helps with that. And just like with counseling, it's all individualized. So do you want me to talk about how
Yeah,
Vector
Yes,
works
please.
and
yeah,
how we go through
please,
that?
please,
Okay.
because a lot
So
of people don't understand it and they see it and they get a misconception. That's one of the problems that's led up to a problem we have right now, which we can get into in a little bit. But it's a lot of misconceptions. Let me tell you, I live with that every day because in what I do in the mortgage field with seniors, the misconceptions about what I do are amazing.
Hmm.
And at half the time, I'm not counseling people, I'm helping people just understand what isn't, what is wrong, what is not truth. So please jump
right.
into that, Misty.
So one of the things that happens when you come to Symbiose, you start off by seeing the medical doctor, like we talked about before. You can get a referral for pain management. You can get a referral for Vector. You can get a referral for psychological evaluation, in which you come to see our side of the house therapy. Which with the Vector referral, you'll go through something called ANS and neuro scans, which basically there's scans, the palms of your hands, the balls of your feet are your feet, and then there's this cool looking cap with all these little things on there that do your neuroscan. And then after that, there's 3 different documents that are created based on your results of those scans. And I'm sure Dr. Ashmore has talked about this while she's been on, but I'm going to give you the layman's perspective from what it was like for me. So I did my ANS and I did my neuro. I am 100% disabled veteran, severe PTSD, and a lot of injuries, neck injuries, feet, back, shoulders, you name it. So I have a lot of pain and arthritis and different things like that. So I did my ANS and my neuro scan, and what they showed was problems with my heart and problems with my circulation and neuropathy. So all this time as a veteran, I have been going back and forth with the VA because the last few years in a row, I have had severe chest pains. The December before last, I was actually rushed to the hospital thinking I was having a heart attack, and I had something, they call it a micro heart attack, but essentially my blood's not pumping the right way in my heart. Of course, the VA does the stress test, blah, blah, blah. Things come back, and my doctor says, you just need to find a job that's less stressful. It's just environment. It's just environment. And that's all I've heard for several years, but I've had these heart issues for several years. So I get this report from Symbios that says a whole bunch of medical jargon. But what it said to me was, Misty, you're not crazy. There is something wrong with your heart, and you have neuropathy. That's why your feet are always numb and cold, and your fingers are always tingling, and you're in all this pain. And so with that, the doctors at Symbios set up my vector treatment to treat my heart problems and to treat my neuropathy in my feet. So the first time they did the scans, I forget what the imaging is called, but when you sit down for vector treatment, they do scans that show your blood flow.
Yes.
I had no fingers on my hands. And I had no toes.
Wow.
So it showed very blatantly how much I had no circulation in my body. And one of the first things that they kind of process is like, okay, let's give her a blanket and warm her up when you sit in the vector chairs, right?
Yeah, they use blankets a lot.
Right. But for me, it was so empowering to be able to say, this is what's wrong, and there is treatment, and I can feel better. So I did 12 treatments straight. And immediately, it was probably the 3rd day, I was sleeping better. I'd gotten my first 8 hours of sleep, and I don't even know how long. My chest pain had finally lessened, where it wasn't all the time. Now it's just kind of sporadic back and forth. And I had feeling in my feet. I could actually feel my toes. And so I know that there's a lot of stories, and there's, the education behind vector. But for me, just being a person that is a veteran, has been told over and over, it's just your plantar fasciitis. There's nothing wrong. There's nothing wrong. To be able to see a document, to see my own scans and say there is something wrong. And it was so validating to me. It made me feel like somebody listened to me and was actually going to help me with those specific things. Now, if I came in and I said I wanted to work on my anxiety, I wanted to work on this and that, there's different vector settings for different things that the client needs. Like there's settings for dementia, there's settings for depression, there's settings for anxiety. My treatment protocol was to treat exactly my heart conditions, my heart issues, and my feet. But yeah, that was my experience with vector.
There was a couple in there the other day, and he's a veteran, and his wife is there with him, and she's getting treated as well. But he's got early stages of Alzheimer's, and after I talked to him, he's got it together. Now,
Right.
I have a good friend who was in a terrible automobile accident, hit head on, had tremendous traumatic brain injury. It took several months before it manifested. And I have a class 4 medical laser, which is FDA approved. The Vector is FDA approved and AMA approved. And I treated the guy. I sent the guy to Phoenix Sterilase, and I treated him as well, and had a total recovery and comeback. Now, these things don't cure. We can't say it cures,
Right.
but you can have recovery. It enables your body to recover. And the way that the Vector works is total body.
Right.
Where a laser is very, very specific and isolated. But the main thing that both do, it's new integrative, and the term is integrative, meaning these electronic technologies basically increase blood flow.
Right.
And you really don't understand how that works till you experience it.
Right.
Now, it's different for everybody. Every human body is different. Everybody I have talked to in treatment there, as well as myself, who's been treated, has amazing stories.
Mhm.
Billy, who's the office manager now, was a ranger. He was command master sergeant, Army. His last jump, he
Mm.
fell in a hole.
Oh my.
He didn't see what he was jumping into and messed up his legs. He told me he could barely walk when he went to Symbiose. He was suicidal when he went to Symbiose. He was so depressed because he just in so much pain and taking so many pain pills. Now he's off all the pain pills. He can jog, and he's office manager. He's
Mhm.
doing a great job. So this helps people to restore their
Mm.
life. This is a tremendous healing as part of a total system that is monitored by medical doctors and monitored by tests throughout. After
Right.
10 sessions, you go through the test again on the ANS machine to see where you are. And I made substantial improvements. But
Right.
on top of that, for many people, just like in marriage counseling,
Hmm.
you need more than just this. So this gets you off of drugs, this
Right.
gets you out of pain, but gets your brain where it's working and you can then reason and think.
Right.
That's what I think. And we got a problem right now. So let's go ahead and bring it up in that there is a misunderstanding in the VA in North Texas that has cut Symbiose off. And we're working with that to get that resolved because there's some really, really outstanding people. Their whole deal is to make sure everything is right and that the veteran is safe. All of the things that Symbiose is doing is beyond safe, correct, Misty?
Yes, sir. All of our clinicians are, licensed and trained. We have social workers and we have licensed professional counselors. We also have licensed chemical dependency counselors. So our side of the house is well trained and well versed to work with this population. There are several concerns right now, and my very first concern is of utmost importance. And we talked about this earlier about the rapport. So here you have a veteran, or we have several veterans that are working with a clinician and actively working through their trauma stories, trauma cases. Some may be in EMDR therapy, which is extremely difficult to go through. And then they receive a phone call that says Symbiose is no longer a provider and you can't see them anymore. And then that client is told that they're not allowed to come back in for therapy. So that is traumatic for not only the client, because they've now trusted this
Right.
individual, they've started trauma treatment, and now they're being told they can't come to him anymore. That leads to lots of feelings of institutional betrayal
Hmm.
and distrust in the system. But then that also leads to a lot of clinical concerns for my own counselors. So as a counselor, you have practice ethics and guidelines to do no harm, and there is effective way to terminate clients. You have to talk about termination
Right.
sessions well in advance. You have to talk about how the sessions are going to end, what are their coping mechanisms, what is the game plan, safety plans, things that have to be put into place before you terminate a client. There's a whole list of things in our practice guidelines of how to successfully terminate a client or refer them to a new clinician. None of those things can be done when a client is told immediately, effective immediately, you can no longer see the clinician you were seeing. We're sending you to somebody else. So I feel like there's a great harm being done to the clients that are in clinical treatment right now, as well as to the clinicians who are trying to help them.
We had a meeting with several very, very prominent men who talked to about a dozen veterans who've gone through this total program, and they all were telling the same thing. And Dr. Ashmore provided all of the FDA approvals, the AMA approvals, the letters from the various people in the VA who had actually been to the facility and saw what it is. One of the biggest mistakes, and we talked about misunderstandings, is a lot of people think, oh, this is shock therapy. This is not shock therapy. You can't do that. You have to
Right,
do that in a hospital
Hmm.
facility using an anesthesiologist. So this is not that at all. They do
right.
use microcurrents, and you can't even feel it. You cannot feel it. And so it's no needles, no pins, no drugs, and it's getting people off drugs. What is one of the biggest initiatives that the VA has come out with in the last few years to help veterans get off the drugs?
Exactly.
And how do you get off the drugs? Well, you got to get rid of the pain. You got to be able to sleep at night. And this is a system, an integrated health system that enables that to happen. So we're trying to work with the VA to get this misunderstanding taken care of. It is still approved by TriWest. If you are in another city, in another area, you want to get help, go to excuse me, Cedric,
Okay.
my allergies. Go to Symbios website, SYMBIOS Integrative Health. That's SYMBIOS Integrative Health, and take a look. And they have hotels that they've worked special deals with. We're also putting together a 501c3 to help pay for people. Let's say that you are military, but you have less than an honorable discharge and you are not entitled to VA benefits. We're raising the money to be able to have you get those benefits for free. The other thing that we're trying to do is work with spouses as well. You may be a widow, and I've got a couple right now that need some help. So we're setting up to be able to treat people for free. And in the meantime, while we're getting this problem ironed out with the VA in North Texas, and only the VA in North Texas is where this has come up. And I don't think they did this to be mean. I think they did it to try and protect veterans, and they misunderstood what's going on. So we're going to get that fixed, because there's some great people that I have had great success with in the VA. I don't want you to think the VA is bad. It's not. But somebody's got a misunderstanding, and we'll get it fixed. But in the meantime, if you're here and you need help, call Symbios. Call them, look it up online, Symbios Integrative Health. Do you have that phone number in your head, Misty? I can't think of it real quick.
I do not have it in my head. Sorry.
Okay, let me look it up. We want people to know, hey, this is where you go to get help. This is Symbios Integrative Health. The telephone number is 469-983-1300. The phone number is 469-983-1300. You have offices in Tarrant County, down in Arlington. You have an office in Sherman. So if you're in Oklahoma, you could go to Sherman. If you're in Oklahoma and you want to go to Symbios, go through your VA in Oklahoma and ask for Symbios, and you can go to Sherman. And then Dallas, it's on Mockingbird near Love Field. Give them a call, 469. What was that number again? 983-1300. And they're going to help you. We're not going to turn anybody away. It's what Dee Ashmore, Dr. Ashmore, has said to me. And again, it's integrated. It's total health. Medical doctors, clinicians like Dr. Misty Ely, and people working to save lives.
Right.
One of the things is 22 killed, which is now the tribe, and so many people have been talking about the fact that 22 veterans a day commit suicide, correct, Dr. Ely?
Yes, sir.
Okay, this is a way to stop that.
Yep.
This is a way to stop that, and as we make that successful, and I have seen it be successful, then you're going to see the civilian community embrace it as well, because we have an epidemic in teen suicide. We have an epidemic in suicide around the nation. And Dr. Ely, you are an integral part of what they do in a total health system. So we're going to take a break to hear from our sponsors, and we'll be right back after these words. Again, I want to say a special thank you to Fairway Independent Mortgage, who sponsors me and helps sponsor this, and also DBTV Network for putting us on Amazon Fire and Roku, as well as AUN out in California. We're very appreciative, and we're here for you. You want to contact me? Just 214-502-4600. Look us up. We're here for you. We want to have every veteran be treated and be successful. This is Veterans Impact Show. We'll be right back after these words. Welcome back to the Veterans Impact Show, and thanks to our sponsors, Fairway Independent Mortgage and Lone Star Wealth Strategies. Now, let's continue this great conversation. Guys, I got to tell you, Dr. Ely, this is fantastic because so many people, I didn't know till I went through the combat reboot.
Mhm.
I didn't know, and Diane and I have the greatest marriage in the world, but unfortunately, I've had others that I got hurt and they got hurt.
Right.
And everybody, I think everybody in this nation's gone through at least one divorce unless they were blessed beyond belief. Getting counseling.
It's
Misty,
imperative.
you said it. A lot of us military are scared of that. Or,
Mhm.
oh, I can't do it. I don't need that.
That was me.
Hey, that was you?
That was me.
Yeah,
Being a
I
counselor.
plead guilty too. How about you, Misty?
Absolutely. I've been divorced for about 8 years and I'm actually getting married next month. And so it's scary and exciting. And I look at things now as going through my own trauma treatment and going through my own help. I think Cedric said this earlier. A lot of us join, I joined as a traumatized individual and the military traumatized me some more.
Right.
And so I had to get healthy and I had to figure out what normal was to me. I had to figure out what love was to me and how did I define those things. And then I had to be a healthy individual in order to be able to accept love from somebody else. And so I think it's absolutely spot on. And for a lot of military veterans, it's one, asking for help, but two, bringing the spouse in so that they can understand
Mhm.
what PTSD looks like, what triggers look like, what moral injury looks like, what are some of the words you shouldn't say to your spouse.
Right.
Really, the education behind what's going on in the mental health of their veteran is so important. So, Cedric, I'm so happy that you're doing that work because it is greatly needed. I feel that a lot of veteran families split up because of the simple not understanding how to help that spouse that needs so much but can't communicate what they need.
Right. We have a saying, the relationship is in the knowing.
Mm-hmm.
Right. The
Absolutely.
more I know about my mate, not mind reading, but just the physical aspects, the body language, the things, the triggers. The more I know, and the more I care, then the more I pay attention. I'm aware, and again, we go together to get the
Yeah.
counseling. So that we can learn about one another. We're seeing more of that, but more people need to get it.
Mhm.
You
Yeah.
know, one of the things I told you guys are going to laugh at this. I went through every firefighting school the Navy ever could give me. And I've told Diane and I've told others, whatever you do, I may be sound asleep, I may be on the couch or something like that. You think it's funny to clap your hands or yell, but for crying out loud, do not say the word fire
Hmm.
because I'll come up like a bat out of hell and I'm ready to fight that fire.
Right.
And you could get hurt because I'm not paying attention to you. I'm looking for the fire. And that's one of my triggers.
Hmm.
And I think too, the the previous marriages, I married some really great people. I didn't do them any favors and vice versa, but we did not know each other. What
Right.
you're talking about, we did not know each other, and there's a huge communication gap. That's where again, marriage counseling. So if you're one of those crusty old Vietnam guys, or a few of the guys I've talked to from Korea, or from any of the 9/11, post 9/11,
Mm.
I highly recommend, even if you don't want to go through the VA or you're not signed up for the VA, call Symbios.
Yes.
Call them. We gave you out the number. We'll give it out again. Give it out, Cedric,
469-983-1300.
and tell them Jim Blythe said, I need to call and get an appointment because they're going to help you. They're going to help
Right.
you, and they're going to make it where you can afford it, whatever it takes, because we're raising money to do just exactly that. Dr. Ely, it's amazing. You were a Marine. You are a Marine. You're never
Yes, sir.
not a Marine. What would you say to
Exactly.
a young man, or yeah, especially a young woman, very quickly, who might be interested in they're graduating from high school, graduating from college, and might be interested in serving our nation? What would you say to them?
I would say figure out why you want to go. What is it that you want to do with your life, and how can the military propel you in that way to help you pursue your ambitions and dreams? I wish somebody would have said that to me because I would have maybe picked a different career field, but still the Marine Corps for me, my son, actually, we had this conversation over Christmas break because he is thinking, he's in nursing school now, but he's thinking he might join the Coast Guard or the Navy. And the first question I asked him was why? And he said, I think I would like to carry on the family tradition of serving our country. And then he said, and also I would love to be able to do my medical practice, to be a nurse and be able to travel and see the world. So I think the very first step is figuring out what it is that they want and how the military can help them pursue those dreams if that's really what their dream is. And I think more people need to be educated about what the military is all about and the different skill sets and what we do, and that we're not trained killers. Essentially, that's what most people think. We do have that training, but we're so much more than that. And I think passing that on to the younger generation is very, very important.
I think it's not only service, but they learn leadership, they learn to work as a team,
Yes.
they learn skills, and they get, when I got out of the Navy, I thought, oh my God, I'm 4 years behind all my contemporaries, my fraternity brothers from SMU. You know what? I went way past them
Mhm.
because I had skills that they didn't get, and I got them while I was in the Navy. The Navy and Marine Corps, they share much of the same training in schools. It's amazing what you can learn.
Right.
So, thank you, Dr. Ely. Thank you
Yes, sir.
again for representing Symbios, which I have become very, very, very close friends with because they're helping me. Let them help you. Cedric, we like to close this with a prayer.
Yes, sir.
So you're the minister, but I'm the chaplain. So
You go
can I
for
do?
it.
All right. Lord God of the universe, we are so eternally grateful for all you do, that all you have created for us and bless us. And we thank you for that. Thank you for your hedge of protection around our active duty military and our first responders, those who run into the fire instead of away from it. Thank you, dear God, for our veterans and protecting them and guiding them so they may help us to bring this nation back together again. One nation under God, indivisible, with liberty and justice for all. In your holy name we pray. Thank you, Lord
Amen.
God. Amen.
Amen.
Dr. Ely, it's been a blessing to talk to you. I'll see you soon at Symbios.
Nice
Okay.
meeting you,
Thank
Dr.
you.
Ely.
Nice to meet you.
All right. Thank you again. This is the Veterans Impact Show. Share this. Get this word out. We want to save lives. We want the 22 kill statistic to go to zero
Yes.
by helping veterans with their medical challenges and their